A2E assessment for a deteriorating patient. If I suspect the patient has coronavirus, I would be wearing my FFP2 mask, my gloves and my gown. If the patient is not suspected, we'll just go in with a pair of gloves as normal. On the wards you have news charts. Inside it will show you what observations we're doing, and then they are colour coded. So 0 is normal, 1 they're getting sick, 2 they're getting sicker, and 3 they are very sick. Do your observations, add up each parameter, and you will get a score. On this page here there is an escalation protocol. If they reach 7 or more, you must call an ambulance. The A2E assessment that we're about to perform is also on the escalation protocol if you need reminding, and when you communicate this to the ambulance service, your doctors, your colleagues, please use the SBARD, which is also located in your news chart. Also on the wards, you should have an A2E assessment which will help you remember how to perform the A2E assessment correctly and what vital signs and what to look for. Nikki, we're going to do an A2E assessment on Mr. Smith.
Okay.
So, we'll start with his airway.
Hello, Mr. Smith. How are you this morning? Are you feeling okay?
Mr. Smith is talking to us, so we're happy with his airway.
Lovely.
We're then going to look at his breathing.
Okay. If I do his respirations
Yep.
for a full minute.
Brilliant.
Okay, so I'll be counting his chest rising for a full minute. If Mr. Smith was uncooperative, I would just count the respirations for as long as I could and document. Okay, so
What is Mr. Smith's respiratory rate?
after 1 full minute, it's 23.
23. So that is scoring a 2 on our news chart. So next we need to look at the saturation probe. So please put the saturation probe on their finger 4%.
Right, Mr. Smith is reading at 92% on room air.
So Mr. Smith now requires 15 litres of oxygen through a non-rebreathe mask.
Right, my oxygen cylinder. Okay. Oxygen cylinder will be lying down at all times, but to connect it, I have my non-rebreathe mask. My non-rebreathe mask, it has a bag attached and it has a valve in. I attach the oxygen to the mask. Ensure the oxygen is on, and then I am whacking it up to max, which is 15 litres. My mask, my oxygen on the floor, laying it flat. My mask is non-rebreathe. I have to put my finger on the green valve, and then the bag will inflate. Once that is inflated, I am then able to put the mask on to Mr. Smith. Just putting this on, Mr. Smith. There we are. That should help with your breathing. Okay. Lovely.
What does Mr. Smith's colour look like?
Not that great, really. Quite a bit pale.
Has he got any blueness around his lips, his fingertips?
A little, but not too obvious at the moment.
That oxygen should help.
Yes.
Is he using accessory muscles to breathe?
His shoulders, is moving his shoulders a bit.
Okay.
Yes, you can see that he's struggling a little bit.
So he is using accessory muscles. And can you hear any extra noises? Is there a wheeze?
There is
there
a slight
stridor?
wheeze. Yes, a slight wheeze. Not a stridor at this stage, but there is a slight bubbly wheeze.
So we've dealt with his airway, we've done his breathing, we're going to move on to circulation.
Okay.
So, Nikki, please could you take a manual pulse using his radial artery?
Okay. Right. Using my 2 fingers, and I'm going to be counting. I'm just going to count your pulse for a full minute, Mr. Smith.
Nikki, what is his pulse?
His pulse is about 112.
While you're there, if they have a radial pulse, that does mean their blood pressure is over 90 systolic, so that's quite reassuring.
Okay, so if I don't have equipment to do a blood pressure, I know that his blood pressure is okay because I can feel a pulse by his wrist.
But can we do a blood pressure since we have the equipment?
Yes. Just going to do your blood pressure, Mr. Smith. Okay. Okay.
While that's running, we could then do a temperature.
And cap refill?
Brilliant. So his temperature currently is 38.2.
Yes, 38.2 his temperature is.
Okay, and do a cap refill.
Right, for cap refill, I will get Mr. Smith's finger and I squeeze the nail bed for 5 seconds. After 5 seconds, I release it and his colour should return within 2. His colour's returning in 4.
Okay,
There's a slight delay there.
thank you. And do we know if Mr. Smith's had a wee today?
Mr. Smith, what's your food and fluid intake? When was the last time you ate? Okay. And what about when you've been to the loo? Have you any problems with passing urine? Can you remember the last time you spent a penny? Okay. Right, yes.
Great questioning. So now we've done C, we're then going to move on to D, which is disability. So using the AVPU scale, so is Mr. Smith alert? Is he responding to voice? Is he responding to pain? Or is he unresponsive?
Mr. Smith has been answering all my questions, so he is alert.
Brilliant.
If he didn't respond, I would be talking more to see if I can get a voice response. If he wasn't responding to voice, I would inflict a bit of pain to see if he responds to pain, so I would do a trapeze squeeze. Thank you, Mr. Smith. If he didn't respond to pain, he would be...
We now need to think about doing his blood glucose with a glucose machine. A normal level should be between 4 and 7 millimoles.
Yeah.
We then need to think about Mr. Smith's pupils. Please could you look at those? Are they pinpoint? Are they dilated? Are they unequal?
They're absolutely fine, and I don't need a pen torch to actually tell that. Mr. Smith has been talking to me. His pupils are equal, both equal.
If Mr. Smith was unconscious but breathing, we could think about putting him in the recovery position. Once we've done D, we need to move on to E. So we need to expose Mr. Smith and we need to look at his front and his back. So, Nikki, what are we looking for when we expose?
We're looking for anything which could be contributing to the way Mr. Smith is feeling. So I'd want to ask Mr. Smith if he feels uncomfortable, got any painful areas, if there's evidence of any rash or any injuries which could be not looking that great, could possibly be becoming infected, which could possibly be the start of sepsis. I could be asking if there's any red, warm, large areas because of the possibility of DVTs, particularly as he is laying in bed for long periods of time.
We need to also think about multi-ligatures with our patients as well.
Yes.
So I've calculated his new score and Mr. Smith's new score is 7. So what we need to do is we need to phone 999. We need to tell them that potentially this patient has coronavirus and we will be doing continuous monitoring till the ambulance arrives.
Okay.
Thank you.